And this can impact our health, our behavior, and our emotions in different ways. Overactivity of the stress response can be associated with a variety of symptoms, some of which are familiar and others which might be less well known. So familiar symptoms might include changes to sleep patterns or appetite. I think many of us may be experiencing that right now. Mood changes such as anxiety or depression or anger, or increased risk of substance use or relapse, or increased risk of family violence. However, health conditions like headaches or abdominal pain or digestive difficulties, things like increased blood pressure or blood sugar or asthma exacerbations, or even increased risk of infection are also associated with an overactive stress response. So it's important for folks to know that these changes aren't just in your head, right? And to begin to identify how stress shows up for you physically, emotionally, and behaviorally. So the good news is that there are simple things that we can do every day at home to protect your health. And the California Surgeon General's playbooks for stress relief during COVID-19 is available at covid19.ca.gov. And these playbooks share important information on things that we can do to practice quality self-care to support our families and also support our families to do the same. So things like, next slide, please, sleep, exercise, nutrition, mindfulness, mental health supports, and supportive relationships are all evidence-based approaches for regulating those stress hormones, right? And helping to improve both our physical and mental health during this time when we're all experiencing just high levels of stress. Safe, stable, and nurturing relationships actually help to protect our brains and bodies from the stress of adversity. And things like healthy nutrition, regular exercise, good sleep hygiene, practicing mindfulness like meditation. Now is a great time to download that mindfulness app on your phone, right? And really getting access to that mental health care can help to decrease stress hormones and improve health. So if you're concerned about the effect of stress on your health, call your doctor or a mental health professional. And again, you can download the stress relief playbooks at covid19.ca.gov. Next slide, please. We know that children are especially sensitive to the effects of stress because their brains and bodies are just developing. And a key ingredient for healthy kids is a healthy caregiver. So we've also provided the Surgeon General's playbook for stress relief for caregivers and kids, which is also available at covid19.ca.gov. We'd also like to share the Together for Wellness site, which offers evidence-based resources and tools for parents and children to help manage stress and other resources to support wellness. Next slide. For our healthcare workers who have been continually, on the front lines of addressing not only COVID-19, but we recognize that our healthcare workers are also on the front lines of helping to address stress and adversity and its impact on our health and our well-being. And I'm really pleased and proud to share that California has launched a first in the nation effort called ACEs Aware. ACEs referring to the effect of adverse childhood experiences. And any provider can go to acesaware.org and learn how to develop a trauma-informed practice, the principles of trauma-informed care, how to screen for ACEs and recognize the signs and symptoms of the toxic stress response when that biological stress response starts to become overactive. And so again, that's available at acesaware.org, and any provider can go and get trained. Next slide, please. And for our healthcare workers and the critical role that they play being on the front lines, I want to express my profound gratitude to our healthcare workers who have been continually fighting the virus in the field and facing it every day. And the stress of being on the front lines is very real. And so we want to make sure that healthcare providers are aware that there are resources available at COVID-19 counseling ca.org. That's COVID-19 counseling ca.org. And that resource offers supports to our healthcare workers and first responders who are impacted by the stress of the COVID-19 pandemic. Next slide, please. So there's one thing I want to say is that if this feels hard, it's because it's hard. We are in the middle of a once in 100 years pandemic, compounded by the impact of the climate crisis and wildfires, and on top of which the issues of social injustice that we are seeing in front of us every day. And so these combined stressors certainly can be a lot for anyone. And I want to make sure that folks recognize that there are things that we can do to help to mitigate that stress. Number one is just pause and remember to breathe, right? If you need to take a break, it's a good idea to take a break from social media, from the media coverage, put down the remote from the news cycle for a little bit, and take time to plug in to the folks who we're closest to, our trusted relationships. Be kind to your body, right? Eat well, do that regular sleep, minimize alcohol, tobacco, and other substances. And getting outside and exercising, right? When the air is at a healthy level is really important to help to mitigate those stress hormones and help us feel not only mentally, but also physically better. Next slide, please. And finally, these simple acts really make a big difference to enhance your mental and physical health, and also the mental and physical health of those that we love, right? So it's staying connected even though we're physically separated. If you're worried that someone's in trouble, ask them how they're doing. And if you see something, say something. If you're worried, go ahead and ask. Staying physically active, I can't emphasize that enough. And really learning how that practice of mindfulness, really there's really good evidence and science in showing how that can help to regulate our stress hormones and improve our physical and emotional well-being. And of course, most importantly, stay, as we say, Cal hopeful, right? Staying hopeful is a really important piece. And I just want to emphasize, remember, self-care isn't selfish. So as we take this moment to put our own oxygen masks on, that is the first step of being there so that we can be available to those we love. And I'll now pass it back to Secretary Ghaly to hear more. Thank you.
Dr. Burke-Harris, thank you for joining me today. Really valuable insights. I think everyone hearing, even if they've heard it before, some of the messages that you're sharing, and of course, the valuable tools that are available through the California websites that give us a reminder of those tools and even some valuable lessons on how to navigate through this difficult period. I now want to turn our attention to where we are with our blueprint for a safer economy. As a reminder, at the end of August, it's almost been a month now, we've laid out a new way for us to engage in our economy, to have additional operations of certain businesses throughout our communities. And these are the criteria that not only allow us to loosen some, but also, when needed, tighten the restrictions on activities. Again, every county is assigned a tier based on test positivity, an adjusted case rate, and a still forthcoming, but very close now, equity metric that we'll be announcing. So we have 4 tiers color-coded. We have the purple widespread, we have red substantial transmission, orange moderate transmission, and yellow minimal transmission. You'll see that each one of those tiers has a number of new cases allowed on a daily basis, as well as a test positivity rate that's an average over 7 days. I'll remind you that we have a lag in the data that we look at. We don't look at today's data today, we look at it a week in behind, so we give enough time for our counties and for the state to receive all of the data for a specific day or week before analyzing it. So for today, we're looking at a number of counties moving from purple tier to the red tier. These include Butte County, Contra Costa County, Fresno County, Sacramento County, San Joaquin County, Santa Barbara County, and Yolo County. Today also, 3 counties are moving into the orange from red. That's Amador, Calaveras, and San Francisco. San Francisco is moving today after a close set of conversations over the past week with San Francisco County health leadership around data and looking at it closely, now advancing that county into the orange tier. I'll say that there's a number of counties also that have, if you go to the CDPH website as well as the covid19.ca.gov website, you can see that there's a number of other counties that have met the first week of a threshold for a less restrictive tier. And next week, we'll see if those trends hold, that a number of other counties will be advancing. I also wanted to take a minute to remind people of a very valuable resource. The Surgeon General mentioned some real practical tools on taking care of your health, working as communities and within households to support one another. But I want to remind you that California has a version of Medicaid called Medi-Cal in California. Many Californians are part of this valuable free insurance program that allows you to take care of all of these needs, your physical health, mental health, other types of health needs, including flu shots, COVID-19 testing and care, and many more things. We know that a number of people and families may have recently lost insurance coverage, and Medi-Cal becomes an important, convenient way to continue having that coverage that we think is so important and valuable to keep up not just our individual and our family's health, but our community health overall. If you need to apply for health coverage, we ask you to go to the Covered California, the coveredca.com/apply website. You can apply online today. You go through the Covered California website. That's our initial website, homepage, front page, to get to the Medi-Cal application as well. So if you screen out of Covered California or you're eligible for Medi-Cal, you will be prompted to fill out the Medi-Cal application online today. You can also call 1-800-300-1506. Again, it's 1-800-300-1506. And as we always do, I want to remind you that simple acts do make a big difference. We talked last Friday about some upward trends, our concerns if we don't make additional changes and really keep our guard up, that hospitalizations would increase. We share that information because we know we have the tools to be able to manage COVID transmission in our communities. It requires us to do these simple things to maintain transmission rates lower, even get them even lower as we enter flu season, as we enter colder weather in the coming months, so that we can maintain all of the activities that we are enjoying today, and hopefully additional activities in the future as we see those transmission rates continue to come down. These things include wearing a mask, these masks, more and more data demonstrating their effectiveness, maintaining that physical distance when you're out and about, washing your hands, of course, minimizing mixing when you can, and another reminder to get your flu shot, just like the governor did yesterday. Many of us, I did it the the week before, really getting that flu shot, protecting ourselves and our communities, and making sure we don't pick up what is a common virus this time of year, worried that it might be COVID, rushing into an urgent care or an emergency room, and maybe picking up an infection while we're there. So really use this opportunity if you can, get your flu shot, visit some of the free flu shot resources that we have on the CDPH website to learn more where you can receive this important vaccination. So with that, I'll turn it over to the first reporter question. Thank you.
Adam Beam, Associated Press.
Thank you, Dr. Ghaly. I have two questions. First, why is the state allowing more reopenings while at the same time expressing alarm about rising numbers? Yesterday, Governor Newsom talked about this R effective and how it's rising in some of the state's most populated areas and how that was concerning. And secondly, the state just issued guidance for outdoor playgrounds, yet in many areas of the state, children have been using public parks for months. Have community outbreaks been traced to those activities? And why do park guidelines call for wearing masks and physically distancing at all times while the guidelines for youth sports do not?
Sure, great questions. To the first one, part of what we want to make sure we do at the state level, joined with our county partners as well, is make sure we share the data and the trends that we see. So much of what we see early can actually be mitigated by increasing our own protective behaviors, the wearing the mask, remaining physically distanced. So as we sound a bit of the early alarm, it's really a reminder to be able to do more to reduce transmission in our communities. We believe the slow, stringent plan allows us to take into account some of those trends and shifts. And when a county isn't able to move forward through the blueprint, they won't. They will actually have a pause. A number of counties that last week met the first week threshold to advance didn't this time around, and therefore haven't moved forward. But in a number of places, as we've said at the top and many times before, the transmission rates in different counties are different. We don't live in the aggregate. Our blueprint allows for those differences in counties and regions to be respected and allow counties to move forward. So on the one hand, we certainly do want to make sure that Californians are paying attention to the numbers just as we do, that we're seeing those early trends and acting accordingly. But we also know that the earlier we act, the more we can ensure that a county in one part of the state's trend doesn't impact another one because we're keeping our guard up. As it goes for playgrounds, yes, we know that a number of playgrounds, some of us have seen in our own communities that they've been used. Actually, in my communities down in Southern California and Los Angeles, the number of playgrounds that are still closed off to young people using them is high. So the playground guidance gives us a chance to move the whole state forward. We know, just as the Surgeon General outlined, more outlets for young people where the risk of transmission is low, that we're not just protecting those young people, but the caregivers that bring them to the playground. Putting out this guidance gives us a chance to really work with our local partners, those counties, those cities, to ensure we put out the best information to use all parks in a lower risk way. There have not been, as far as we know at the state level, any significant outbreaks traced to a park. But we do put together these guidelines in order to ensure that we reduce risk as much as possible. The comparison to youth sports and other group activities, really in a playground, you do invite mixing of a lot of different households all at once. One day you may see a totally different group of young children and families using the playground than you did the last time you visited. In some of the youth sports activities, the stable cohort aspect is really important. And so we do see there being differences in the type of mixing between those different activities.
R.T. Watson, Wall Street Journal.
Hello, sir. I'm also looking for a little bit of clarity when it comes to sort of what public spaces can open and cannot open still. And I was wondering if where you were in terms of specifying when theme parks might reopen as part of the operations, or indoor part or outdoor. It looks like Orange County didn't move to the orange tier, so maybe that makes the case more difficult for, say, Disneyland. But I was just wondering if you could clarify the situation with theme parks and where you're at.
Sure. Thanks for the question. And we're working hard to get that out in a responsible way as soon as possible. So planning can be done by both the counties that are homes to the theme parks, as well as the operators of those theme parks. We know that a number of Californians are eager and wondering when that is coming. And we're working with those industries to put out something that's thoughtful, allows us to maintain the rest of our framework in a strong way, and really following those principles of slow and stringent to ensure those large activities are done responsibly. So not quite yet, but we're getting very close.
Spencer Custodio, the voice of OC.
Hi, Dr. Ghaly. Thanks for taking our questions. I got a couple for you. The theme park was already asked, so thank you, Wall Street Journal, for that one. But the LA Convention Center this December is planning on holding, at least to a media report yesterday, the news report, this December is planning on holding the Los Angeles Comic Con. The event organizers have said they've talked with health officials. I emailed the Department of Public Health and, said they're in the purple tier right now. And, convention centers aren't supposed to be open anytime soon. I don't know if there's guidance out there for them and what tier they're allowed to be reopened. But my question would be, has state health officials cleared this kind of move? Tickets went on sale today. This isn't supposed to be until mid-December, but the way the trends in LA are going doesn't look like, that county will be moving up to orange anytime soon, especially as you had mentioned yesterday, the governor has mentioned yesterday, cases are starting to increase and there's a fear of a second wave in the fall. So what kind of guidance is out there on convention centers, and is there a certain tier they're going to open, and have you or any of your representatives talk to the organizers of this upcoming convention in December?
Yeah, thank you for the question. I saw the same news clip, and I will tell you that the guidance for convention centers should also be out soon. They are not in our tiering system yet. We are, of course, putting the same thoughtful energy in, working with operators who have questions about how convention centers will move forward in our tiering system. So stay tuned, that should come out soon. And to your question specifically about the LA convention that's planned in December, no, as far as I know, and I certainly haven't myself had any communication with the planners for that convention. And as far as I know, none of our team has, and it would be inconsistent and certainly premature to look at a county like Los Angeles that remains in purple to think that far out. Now, certainly people have hope that transmission rates will come down low enough so activities could be permitted that aren't today, but we have a lot of time and data yet to see before we can really say something like a large convention is going to be allowed at that time.
Patrick Healy, NBC Los Angeles.
Hi, thank you very much. Can you hear me okay?
I can.
Great. Thank you, Doctor. Hoping you can have a little more detail on a couple of issues you've already discussed. Number one, that the projection of the increase in hospitalization, has that estimate been updated any in the 4 days since you issued it last Friday? And the second question regarding playgrounds, if you could talk about how the procedure works, the implementation, does this require new amended health orders from individual counties, or can municipalities and other levels of government just go ahead and open the playgrounds today? Thank you.
Yeah, both good questions. So as I outlined on Friday, what drives our CalCat tool that is publicly available, all of you can find it on our covid19.ca.gov website and link to it. You can see how the information of today gets incorporated to show us if nothing changes, if our same level of case increases continue, if our same level of effort as communities continue to reduce transmission, where our hospitalizations may be in the future. So that number is updated there. on a daily basis, you can certainly visit that. Today's number is just over, when you look at today's cases and you look at the projections for the end of October, a month out, that number is up above 5,400 patients predicted to be hospitalized at that time. But again, I share that these are numbers in a modeling tool that tells us, based on today's conditions, where we may end up. We mention it in order for us as Californians to really keep our guard up, do the things we know that make a difference, especially on the heels of flu and coming into the winter and colder weather, where it's harder to do things that today we can do outdoors, and maybe there'll be an urge to move them indoors. So really, this is part of our slow and stringent concept to continue sharing this information with all of you and all Californians so we can double down on our efforts. In terms of the playgrounds, some local county health orders may need to be updated. I can't speak to what all 58 counties may be required. Remember, these are guidelines. We are asking counties and cities to post these at parks. We know that in terms of different communities' ability to keep a tab on this, that it's variable. So we really are asking our local partners to post this, and that all of us, as we use and enjoy these parks, I know my kids are itching to get out there and see if in our county we'll be allowed to use our playgrounds, that we remind all of the users how to do this in a lower risk way, in a safer way, and to be mindful of the other neighbors who may want to be using the same play structures either at that moment or 30 minutes later.
Claudia Feschweda, KNX News Radio.
Hi. I think a lot of people in LA County, where I am, are starting to feel like it's impossible for us to get out of purple. And if you can talk about, the challenges of such a populous county moving tiers, and also I'd like to understand how the amount of testing affects the adjusted case rate. Thank you.
Sure. Two good questions. And I would say that many large counties have been able to move from purple into red. We've seen that already. LA County met the threshold for red for 1 week. They missed it this week. They may be on the road to meeting it again very soon. So I do believe that there are ways to meet those metrics in large counties, and the thresholds will keep guiding our way. I know that it really is this sort of slow and stringent approach, as we remind people time and time again. And it allows us to ensure that when a county like Los Angeles or any of the 57 other counties and 3 health jurisdictions move through the blueprint, that we can have some confidence, a degree of confidence, that transmission is low enough that those increased activities will not put us at jeopardy of seeing rapid increases in our cases and putting us right back where we just left in the summer. So, I, as a Los Angeles County resident, am hopeful that we'll continue to do what we can to reduce transmission and believe there is a path forward. On your question on how the testing impacts the case rate, what that adjustment is, really, when we look at the average amount of testing across the state, we do compare different counties against that average. And the more you're doing testing, we realize that you may be finding more cases, because the way you find cases is by testing. But as you test more, we recognize that some of those cases you're finding, and you only find them because you're testing more. And so making sure that we're adjusting the case rate accordingly based on the number of tests that a county does is very important, so that we're able to compare case rates based on that testing volume county to county and have a true apples to apples as we move through this blueprint.
Colleen Shelby, Los Angeles Times.
Hi. Several of these counties that are moving forward in the blueprint are directly affected by fires. I'm wondering if there's any indication from the state that those fires that are moving people about or keeping people inside are affecting the cases and kind of helping these counties move forward, or if testing has remained as capacity as it was prior to?
Yeah, a great question. On Friday, we spoke about the confluence of a number of different factors, some of the fires, the air quality issues, evacuations certainly could create conditions where transmission and spread goes up. We hope that with the tools we've talked about, a number of people continue to keep their guard up and really reduce the opportunity for more transmission when that unexpected level of mixing might have occurred. We also urge people that were staying inside during poor air quality or warm weather to do so within their households, to not invite guests in where that transmission might have been increased. So far, the fact that we're seeing counties continue to move about 5 weeks after we started with some of our early fire activity in California gives us some sense that we will already be seeing the effects of those evacuations, air quality, and fire. And for the counties that did move forward today, the impact may have not been significant. That said, we continue to watch the numbers all the time to ensure that we're keeping tabs on this and working hard with the counties to provide the testing resource, to your second question, that's needed to make sure we're tracking transmission. As I said, on one of the first slides showing our testing number, that as we approach an average of 130,000 tests a day, we're getting back to where we were just before the fires. We did certainly see for about 2, almost 3 weeks, some reduction in testing, partly because testing sites were closed due to air quality and fires and weather. And in other cases, the labs that processed the tests were running at a reduced operations or closed altogether to manage some of the same events.
Tom Kiskin, Ventura County Star.
Yes, sir. I'm calling about Ventura County, where the metrics moved from, or the metrics were met for 1 week. We still have to meet the second week. I was hoping you could address the difficulty of that challenge, and that you're halfway there. How difficult is it to scale the rest of the mountain?
Well, hopefully the same activities that allowed you to meet the threshold once continue. We asked for 2 weeks of consistent meeting the measure, meeting the threshold, in order that we all gain confidence, not just at the state level, but at the local level, that community members can feel confident. We didn't just do it for a week, we've done it for 2 weeks straight, and that allows us to move forward. So I'm hopeful, and we've seen it time and time again, that many counties that meet the threshold for 1 week do indeed meet it the second. And then there's situations where they don't, they miss it by a little bit, but it's all to say that we want to continue to see those downward trends. I'll tell you, based on many conversations with the leaders in Ventura, there continues to be a strong commitment to doing all the things that allow transmission rates to be watched closely, interventions to be put forward, so that that county, along with surrounding counties, continue to see transmission reduce, and look forward to seeing that county move from purple to red in the near future.
Final question, Samantha Young, Kaiser Health News.
Hi, thank you. I was hoping you could just maybe explain a little bit more when a county goes, drops like it has for Sacramento County. There are so many schools now that are looking at coming back in based on being dropped on the tier to red. And it seems a little confusing to a number of constituents here. I've listened to a lot of school board meetings where they talk about the numbers are going to be increasing in the fall, and that the schools might be open for a few weeks and then have to close again. Is that the scenario that you see possibly heading into the fall, when I know have been talking about these projections where hospitalizations and case numbers could rise in the fall?
Certainly, I mean, part of the reason why we talk about them so much is so that we keep our guard up. And our hope, and as I'll remind you, back on the 19th of July, we released our school guidance. That was when we were under the county monitoring framework. We've then provided some explanation on how, when we move from county monitoring to this new blueprint, how the school transition works. But one of the same elements is a 2-week waiting period. So any county that became red today really has this 2-week waiting period before schools can open, really to work with school districts, local communities to make that preparation as solid as possible, as well as to see where the trends go before opening does occur. And we hope always that the continued work to move from red towards orange happens in counties in the red tier and transmission continues to go down. You'll also remember on the July 19th guidance that after a county does begin and a district opens up its schools, that we're really looking at transmission, not just within the community and the county, but within the schools and within that district. And if there are indeed outbreaks in a specific classroom or a school, it may lead to the decision to close one school in a district, not the entire district. If you see multiple schools impacted within a district, you may see the entire district close. And in counties with multiple districts, you may see different districts moving forward differently. So really ensuring that schools are working with their districts, with the teachers and the families, and of course, the public health officials who are there to support. And we as the state are working closely with a number of districts on ensuring that testing is thoughtful and available, that the disease investigation support and contact tracing is available, so that both at the local and state level, we can support schools that do make the move to go to in-person education, that we can support to avoid any threat to return back to closures and go entirely distance learning. We know it's going to be a process. We're working hard with some school districts already, and we'll continue in Sacramento and all counties considering to go back to in-person learning to make sure that we don't see this open up one day, close the next, that we keep this going. That all said, the safety and protection of our students and staff are of paramount importance. And if after opening we see transmission rates go up very quickly, we will work with the school districts to make sure the right decision is made across the state. So with that, I want to just thank you as always to the reporters for the thoughtful questions and a chance to engage on, I think, issues that all Californians are thinking through. I want to just say a moment of really share concern for those families and communities facing the impacts of the wildfires. We know that we're entering into seasons where winds pick up and fires spread a little bit more quickly. And in the world of global pandemic, this becomes even more challenging, as our Surgeon General just mentioned. And just that our hearts and minds are with a number of the communities facing the impacts of wildfires, and our commitment to work with counties to ensure that not only are we paying close attention to COVID, but all of these other impacts on our communities. And again, please wear your mask. Remember the physical distancing, get your flu shot. And today, a special moment, a special thanks to our Surgeon General, our first state Surgeon General, Dr. Nadine Burke-Harris, for joining us, sharing some important concepts and points around behavioral health. And we look forward to seeing you again soon, later this week maybe, but certainly next Tuesday, to update our blueprint and share a little bit more about how our response to COVID is going. So with that, have a good afternoon.